who do you see? What do you do? What happens in your clinic?
Well, because I didn't start vision therapy from the start, I started doing primary care. And so I had really built my primary care practice up, you know, pretty well. And so I was very busy in primary care and I just wasn't as fulfilled as I wanted to be. And um, I feel like I was led to vision therapy. Just kind of multiple things happened that made me realize I need to be doing vision therapy. And I'm just my personality type is I'm a really helping personality. I like to help people, and I feel like it's great to give people a pair of glasses, but when you can change somebody's life with vision therapy, it really just like checks the box for me to help people. And so I just really feel better about coming to work every day knowing that I'm doing that. So I'm about 50-50 now. It's just it's hard to completely eliminate primary care. I have so many established patients that I see. But I'm also one of really only two providers in Memphis that does vision therapy. So there's about 1 million people that live in Memphis. So there's a lot of people that need vision therapy. And so I really stay busy on both sides of it. I would love to one day just exclusively do vision therapy, but I don't know if that's going to be possible because I have such an established patient base unless I just get old enough that all my people get older too and they move on. So we'll see. But that's kind of it. So I'm about 50-50 right now.
Awesome.
And so, like you said, with vision therapy, we get to change lives every single day. And there's like, no, there, I don't know any other job that you can really say that, like every day we change somebody's lives, which is just so amazing. So can you remember like one patient in particular that stands out in your mind?
Yeah, I saw this little boy. He was probably 7 or 8 years old at the time, and he was refractive amblyope. So he was really farsighted in one eye, and then he didn't have any prescription at all in one eye. And the first thing I did was fit him in a contact lens, which for his age was he was pretty young, and his mom was like, "Are you crazy?" And I was like, "Just trust me." And so he went from seeing basically the biggie out of that eye when we put him in the contact. He went down to 20/80, so he got better. And then at the time I was doing vision therapy myself. I didn't have a therapist, and so I was programming everything and working with him once a week. And now when he comes in, he's 2025. He's about to graduate high school. And it's funny because he doesn't want to wear contacts anymore. And so we did all this work with him and he's 2025 in his amblyopic eye. And he comes in every year and his mom says, he hasn't worn his contacts in 6 months. But when he puts his contacts in, he's 2025. So he just chooses to use one eye. But it was really fun because, it was really personal for me because I did all the work with him. And I remember buying him little gifts and dropping stuff off in his mailbox that he could do at home. And he really liked art, and so I got him a lot of stuff like that. So it was just like a fun experience. I said, "This is the right thing. I'm doing the right thing here."